Hello everybody, this is Gary Beck, your naturopath from the Maximum Wellbeing Thyroid Studio. And in the studio today I have much pleasure to introduce to you Dr. Darryl Turner. Dr. Turner.
Hello Gary, how are you?
Very good. Dr. Turner is the inventor of a device known as the Thyroflex. And the Thyroflex is a testing device that we use in the clinic here to determine what is happening with your thyroid function. Now, one of the things that Dr. Turner and I have spoken about is, of course, when we test the thyroid, that's fine. We can get a really good snapshot as to what's happening or what's not happening. But there are many things that will influence your wellness, and one of these things is good quality sleep. Dr. Turner, can you just talk a little about sleep and why it's so important?
Yes. First of all, if you're not getting enough quality sleep, that's 8 hours and 10 minutes per day uninterrupted, you have a sleep problem. The less sleep you have, the less effective the medications, and the less effective you can make decisions. And what is this time with thyroid? Well, thyroid controls, for you women out there, your estrogen and your progesterone. In other words, the estrogen turns your menstrual cycle on, the estrogen stops it. If they're out of balance because of your thyroid, it's going to affect your sleep. The main one in those two is estrogen. And that's why, in fact, when the estrogen drops too low, a lot of perimenopausal and menopausal women have problems with sleep. So we have to address sleep in part of the core hormone balancing act. We have to look at three vital hormones. One is called melatonin, which a lot of you have heard of. That's what keeps you asleep for 8 hours and 10 minutes. Then we have to look at tryptophan and serotonin. So a thing called cortisol, that's your adrenals, that triggers the release of tryptophan. Tryptophan is what makes you get up out of your chair at night time and say, I'm tired and I want to go to bed. Tryptophan is when you go in, you have a shower, you clean your teeth, you get ready and you jump into bed. Serotonin is a rollover effect from tryptophan to serotonin. In fact, tryptophan is you eat a big turkey meal, you feel sleepy, and that is why. The serotonin is what changes you into a sleep pattern. You jump into bed, you need about 10 to 15 minutes to read, never watch TV of course, but to read or talk to your husband or your spouse, and you slowly drift off into la-la land. And then melatonin takes over. Once the melatonin kicks in, you are asleep, uninterrupted, no toilet breaks, nothing for 8 hours and 10 minutes. If you're getting less than 7 hours of sleep a night, you have a sleep disorder. People say, oh, but I only need 6 hours of sleep a night. That's not correct. You need between 7 and 8 hours and 10 minutes sleep a night, uninterrupted.
Yeah, it's an interesting one, Dr. Turner. I know I've certainly worked with patients over the years who have been hard out, go-getter type people, and they say, I only need 4 or 5 hours sleep. And I guess we can get away with that for a certain length of time, but there's always going to be a period where you're going to have to pay the piper, and
yes,
sleep deprivation, the associated stress effect on the body is going to come knocking at some point.
Yes, and sleep disorders cause the body to start to break down. There's a whole cascade of responses that can happen with sleep, but the big one that you've got to worry about is the ability for your body to fight off cancer. Did you know that every day you have about 50 or 60 cancer cells that are trying to take control, trying to encourage other cells in your body to become cancerous like itself? Your immune system is what fights that. If you're sleep deprived, your immune system cannot function properly. And you can let them, and of course you've already let them, but you can allow those cancer cells to start to multiply. So that's why you must get enough sleep.
It's part of that rest and regeneration Don't forget the regeneration. This is what our body needs, this time to just get back down to that really base level of function, to clean out the system, to clear out the cancer cells, to convert things back to the good so that we're ready for the next day. And without that, it's going to be a real struggle on a whole range of different levels. And I guess this is where, Dr. Turner, that once again, we've got that overlap between the thyroid and the adrenals. And we know that things like the cortisol and the serotonin and the tryptophan, they work in these cycles. And that's normal. But unfortunately, with a lot of our modern day stresses and a lot of our modern day toxins and our modern day deficiencies, these cycles have actually become flattened or just don't exist.
Correct.
Is there something else that people should be doing to enhance their sleep?
Yes. Do not turn on any artificial light or devices while you're trying to get to sleep. The worst thing you can do is to watch TV when you're in the tryptophan stage and the serotonin stage. You should not be in bed trying to read an electronic book, on your phone, or watching TV. Those lights interfere with your sleep cycle. That's one thing that you can do for yourself. Number two, a lot of people have twitchy legs and twitchy muscles, and you've got to calm those down. You can do we actually give a lot of our patients a series of exercises where they listen to music in a dark room and they calm themselves down before they jump into bed to try and get a peaceful night's sleep. I hear this so often from many of my patients. I've only slept 3 hours or 4 hours tonight. I know that they're going into a danger zone with their health, and we can help with the right sort of medications, which is a thing called 5-HTP, which is serotonin and tryptophan combined, and then melatonin, and another thing called Trimag, 3 different types of magnesium to calm the body down. We can actually get you to get a lot better night's sleep. As I said, sleep deteriorates, especially for a woman, when the estrogen drops too low. And we can help by correcting, as I said, it loops back into the thyroid again, as it's looping back when I just said a few minutes ago about the cortisol triggering the tryptophan, serotonin. So you have to have all those core hormones balanced, not only to correct the thyroid, but to get a proper night's sleep.
Yeah, wonderful. Yeah, I think that covers it really nicely, Dr. Turner. I think the understanding there that we need these things balanced, and without a good night's sleep, we're going nowhere fast. And we want to encourage you to maybe consider some help for not only your thyroid, but of course your sleep. And we're more than happy to help out here at the Thyroid Studio to get you on the right path. So once again, thank you, Dr. Turner, for spending time with us today.
Thank you for inviting me along, Gary. And I'm very excited to share my insights with all of you out there. Thank you.
Wonderful. Thank you, Dr.